Good morning, good afternoon, everyone. This is Fatima Tsiouris with ICAP headquarters in New York, and it's my pleasure to welcome you to today's Grand Rounds with a really exciting topic on emerging infectious diseases, the value of a One Health approach with Dr. Woutrina Smith. Just before we get started, I'll just ask for folks who are joining us, please type your name and affiliation and the country you're joining us from into the chat box. We will be using the Q&A function to gather your questions, and we will respond to your questions at the end of the presentation. So feel free to type your questions in to the Q&A box at any point during the presentation. And again, we'll take those questions at the end of the presentation. The session today will be recorded and will be posted on ICAP's website. So you'll be able to view the recording as well as access the slides of today's session. Next slide. Great, next slide. So it is our pleasure to welcome Dr. Woutrina Smith. She has joined us very early on the West Coast to give this exciting presentation. Dr. Smith is a professor of infectious disease epidemiology in the School of Veterinary Medicine at the University of California, Davis. And she co-leads the USAID One Health Workforce Next Generation project, which ICAP is part of the consortium. And the goal of this project is to empower member universities within the Africa and Southeast Asia One Health University networks to support workforce empowerment, tracking, and organizational sustainability. She also co-leads the multi-campus Planetary Health Center of Expertise within the UC Global Health Institute and is an associate director at the UC Davis One Health Institute. She supports a number of research projects across Africa, Asia, and in the Americas, where multidisciplinary teams innovate together to solve complex health problems. She has received diverse funding from NIH, as well as USAID and the Department of Defense, as well as the Bill and Melinda Gates Foundation to support her research and training programs. So thank you, Dr. Smith, for joining us so early, your time, and over to you.
Thanks so much, Fatima, and really nice to be together with everyone today. It's been fabulous to work with wonderful colleagues from ICAP around the world as part of our, past 2 years of getting this USAID One Health Workforce Next Generation project off the ground. So I'm going to tell you a little bit about that story. Let me just pull my slides up here because visuals are a lovely thing. Let's see, share, present. Okay, so hopefully everyone can see the slides here. And as Fatima mentioned, I'm based at the University of California, Davis, but I really do work every day with colleagues all over the world, as many of you do as well. So I know that we have that in common, and I really hope that you'll find something in this talk that speaks to you or that resonates with you when you think about the value of a One Health approach. We'll talk a little bit about what that means and some examples and some current activities that are going on. And perhaps that will inspire follow-up action where we can find new ways to connect the dots. So the USAID project, I'll talk about 2 of them. One of them is called PREDICT, that went on for about 10 years. And then the follow-on has been the One Health Workforce Next Generation project, where we have ICAP as a very strong partner. And so there are other members in that global consortium. You can see them shown across the bottom of the logos here. Some of them are coming from AfriHoon and SIAHoon as the two regional networks. We'll talk about that kind of novel approach to global health and capacity strengthening for prevention of infectious diseases. Others are US-based, including EcoHealth Alliance, ADA Health Strategies, some of the other UC campuses, and Project ECHO at University of New Mexico, for example. So it's a large, diverse group of people who have really committed to working together and trying to find innovative training platforms, new ways to really work in the virtual world, given the COVID pandemic. So I'd love to share a little bit about what's been happening with you guys, and then please do use the Q&A. We're very happy to take a deeper dive on anything you like once we go over some of the initial ideas and share some of these pictures and stories with you. So as we all very well appreciate now, we are certainly a globally connected society. And whether it's us moving around the world on the planes with this air traffic map, or it's our food, as we move, as our food moves, the pathogens move with them. And so we really want to think about what can we do to try and strengthen global health security and prevent future pandemics that might emerge as part of that travel chain. So I wanted to spend a few slides here just illustrating the One Health approach, make sure everyone's feeling good about what that means. It certainly can be applied in a variety of ways. I really do think of it as an approach, not a discipline, right? So if we think about what's going on with One Health and we think about where we all live in our own individual farms and houses and places, there's almost always going to be animals around us in some way. We may not notice them, right? But whether it's wildlife like bats and rodents, whether it's pets like dogs and cats, whether it's livestock like cattle and goats, we and our animals in those shared environments share a lot, right? And so we want to think about those connections, the connections between what we do, the animals that are around us, perhaps without even noticing, and then the environmental connections there. If it comes to disease exposure or even non-infectious disease issues, there's often a One Health approach that says the health of animals and people in the environment are all somehow connected. And so really that's what we committed to over 20 years ago now, thinking through how can we get outside of our silos and our disciplinary training and start really working together in teams, right? So we all have an area of expertise. I'm a veterinarian by training first and foremost, but I love working with physicians and nurses and social scientists because we all bring something different to the team. And that's really where we're seeing some of the sustainable problem solving, at the community level, thinking about what One Health can do to bring us together for team-based problem solving and a more holistic approach beyond any one medicine or any one intervention. We need to make sure it's scientifically sound, but also really socially acceptable, and it's going to be sustainable if we want that to last. And I know many of you know that even more than me. So, so think a little bit about, what you do, where you live, what you work on, and are there connections between the people and the animals and their shared environments? If so, then perhaps there is room for that One Health approach to bring new ideas or to recognize what's working and what's not when you think about improving the health of populations. So one of the reasons that I find this One Health approach really useful is it goes beyond just technical knowledge, right? We have a vaccine for COVID, for example, and it really recognizes the need to find practical ways to bring that into the community level or into social contexts in different ways. You could talk about that at different levels globally and regionally and locally. It recognizes the social sciences as an important part of what we do in health, and that was sometimes overlooked, I think, in many contexts for the past decades, but we're getting better at it. And I hope some of you are coming from a social science background, because I find that that is something that is very, very valuable and perhaps not always recognized as much as it should be. So when we think about the health of populations, like you see in the little diagram on the left, right? It's not just understanding the disease dynamics. It's thinking about what are the behavior change and economic issues? What are the societal impacts of what we do? What are the long-term environmental change issues that might exacerbate that problem or not? So as we think about that, we can come up with more integrated approaches to health And that, I think, is a very useful thing in a global landscape that's rapidly changing. So this One Health framework, or this One Health approach, builds on the foundations of health that we were all trained in early on, right? We need to think about what's going on with infectious diseases, non-infectious diseases, what's going on with the food supply, what's going on with WASH or water and sanitation issues, but that's not enough, right? So we have to bring in those arrows that are showing us those cross-cutting themes of education and behavior, economics and policy, culture and society, environmental change. And I'm sure there's others, but this is the concept that 20 years ago was very disturbing to some people because it was a little outside their comfort zone. And we really found that it's okay to not have all the answers as long as you can work in a team where different people have different parts of the answers, then we can probably come up with some good ideas and see if they work or not. So some of the big issues then that are facing society, one of my favorite ones to work on is zoonotic disease emergence. So diseases that are moving between animals and people, and sometimes vice versa. That's my specialty, but there are many other complex problems that you can see listed here on the slide that really need that multidisciplinary approach to problem solving. It could be that you are working in areas where poverty is a big issue, or biodiversity loss, or food and water safety issues, right? Almost any of these problems that are really big challenges for the world need this transdisciplinary approach, or a One Health approach, to look at that intersection between humans, animals, and their shared environments. And we know for any of these problems, there are certain drivers, right? There's certain things that might make them worse or make them better. And so land use change, climate change, globalization, migration of populations, whether that's people or animals, those different drivers are going to have an effect on whether those problems get better or worse. And they will also be influenced by some of the things we mentioned before with culture and behavior change and economics and such. So just different ways to think about how the One Health approach came about and how it really can be useful going forward. So we'll talk a little bit about COVID and other diseases, but really this is something that we found can be very useful. So just to summarize then with a little picture here, we're trying to bring the different populations together, recognize our human animal ecosystem or environmental linkages, and to come up with interventions and approaches to health that are a little bit more holistic, collaborative, and integrated than what we'd been doing previously. And it seems to be getting traction. And I'm really happy to see USAID as one of the groups that has really put their money where their mouth is, and they're supporting this regionally around the world. So there's a lot of definitions, or people have described One Health in different ways. Here's a couple of them. So collaborative efforts of multiple disciplines working locally, nationally, and globally to attain optimal health for people, animals, and the environment is one of the definitions that's gotten quite a bit of traction. A similar one is to think about One Health as the added value in terms of lives saved, economics or financial savings, and improved ecosystem services from closer cooperation and collaboration among human and animal health. And I would say that's not just the scientists, but really recognizing the social aspects of what's going on is a really important part of this, as compared to the single sector or the siloed approach, which is often how many people were trained. So bottom line, right, we're really motivated to start what we do, or to prioritize what we do with the communities, and then to make sure that we circle back and make sure that any health interventions or health programs that we might recommend and support really do make sense for that community. So whether this is a household I worked with in India, and really you can see the One Health approach in action here, right? She's laying out her rice to dry. She's got her animals nearby. There's a little kind of water hole just off the picture to the right, which is used for drinking and bathing. And so the areas for connections, or the potential for disease transmission, whether it's from the animals you see here or the animals you don't, right? The bats and the rodents, for example, the primates that are off in the forest there, certainly are significant, but risk is risk is around us all the time, right? We just have to decide how to manage it. And so prioritizing risk is something we're going to talk a little bit more about in a few minutes. So if you think about what kind of animals or what kind of wildlife we live with every day, you know, some of them are very obvious, right? They might be our pets, they might be our farm animals, but some of them are very subtle. And this is a picture from my barn out back, and there's a little bat in there, and you'd never know he's there unless you knew to look. But we have found, as we work with colleagues around the world, that these bats and the rodents are very good at just living around us without us ever even noticing. And so we would go to new places and we say, hey, we'd love to learn more about what's happening with bats in your area. You know, we're studying the bats. And they'd say, no, we don't have bats. And we say, well, what about birds that fly at night that are kind of dark? And they say, oh yeah, there's lots of those, right? So sometimes the way we're connecting with each other and learning about things can happen at different levels. And we certainly have found bats as one of the reservoirs for viruses that can spill over and can cause problems. Now, whether or not we see the problems as clinical disease in people or animals is a little bit variable, right? So the host, whether it's me or my cows or one of the mountain gorillas that you can see on the right, we all have our immune systems as defenses. We have certain reasons why we might fight off disease or even get infected but not look sick. There are aspects, though, related to the pathogen itself, so viral characteristics and virulence traits, for example, that might contribute to whether or not we look sick. And then there's environmental aspects. How much of that pathogen were we exposed to, for example? What's the dose? Can it survive well? And those things will also affect whether we get sick. So my slide here is just to remind us that typically when we see animals or people that look sick, that's just the tip of the iceberg. There's a whole lot more going on in the community where you may have asymptomatic infections. It obviously depends on the pathogen. You know, Ebola is very different than SARS-2 coronavirus, for example. But this aspect of the epidemiologic triangle that helps us understand disease dynamics certainly can make it a little bit tricky to figure out, well, who's infected and who's not. And then we rely on diagnostic tests of various kinds that have been improving to really get a handle on infections and incidence and then prevention. So we talked a little bit about some of the complex problems. Land use change is just an example of one of the drivers and that's causing some of the increased interactions between populations of people, populations of animals, and of course, as our global population of humans around the world is going up and up, then we need more food, we need more water, we change where we live because we need more space, and so all of that will change the wildlife and the new things that we interact with. As we clear the forest to build new places, then we're going to be displacing animals, and so sometimes we see increased rates of potential spillover events or disease issues going on in those edge areas where you have the new interactions between populations and the animals and the environment there. So here's a few of those drivers. We're going to focus in a little bit more on some of the known and novel infectious disease concepts and the One Health approach that we've been using to try and understand them. But we do want to think about interfaces. Where are the places that animals and people might come into contact? And some of these different drivers that go along with migration of populations, markets and trade, poverty and social inequality, access issues, those will change the interface or the access point for certain pathogens with new hosts. So if we think about why a One Health approach becomes important or why it might make sense, in the global economy, you can see here just a quick chart that shows us the cost of outbreaks. And you can see along the x-axis over time, going back as far as 2002 here. And you can see just a display of the relative size of the cost of some of the outbreaks that have happened. So you could look at SARS coronavirus, right? That was back in the early 2000s, estimated cost of $30 to $50 billion US dollars. You can think about what happened with avian flu and H1N1 influenza, right? All really important outbreaks and things that involve spillover events in some way. You could think about what goes on with Ebola, right? This is one Ebola outbreak, but of course they've been happening over time periodically, but this is certainly one that got our attention around 2015. Zika came on board while we were doing our PREDICT project and just after we cut out Latin America from the portfolio, which was a big bummer. But really, compared to all of these things, COVID has really come on in a whole new way. So the current estimate is about $3.9 trillion is the cost of the COVID-19 pandemic. I didn't estimate this. This was from external sources. But it really does put in perspective the cost of understanding spillover, of preventing the next pandemic is something we really should be thinking about, because we can't afford both human lives and economics to really have this type of issue shut the world down in this way. So we want to think about how do we understand why this happened, how do we prevent it in the future? And of course, there's a number of different things that factor into that. So what goes along with really implementing a One Health approach? In my case, and for some of us at UC Davis, really took traction starting around 2009. And we started this PREDICT project. So this was a USAID supported One Health surveillance project that we led out of UC Davis with a global consortium. You'll see some familiar partners here. These were, not all of them, but some of the main players that we had during this 11 years of the PREDICT project. So let me show you a little bit about what worked and what didn't in that project, because it really was one of the first systematic approaches to implementing One Health surveillance for people and wildlife in several of the global regions. And this is what led us to find a way to detect both known and novel viruses that might be spilling over and could cause pandemics, such as the SARS-2 coronavirus COVID-19 pandemic. And now we've found ways to build on that going forward. So we think about how land use change as an example, how human population growth might be connected to increased contact, right? We talked about interfaces, contact between people and livestock and wildlife, for example. As we have that increased contact or novel contact, then we have more of a chance for spillover events or for pathogens to move between populations. Not surprising, right? So that's going to increase our health risk for humans, livestock, and wildlife, right? It might be that we get sick or it might be that the animals do, but that may have potential for further transmission. And then of course, as we or our animals are getting sick, then there are effects on our livelihoods. Can we work? Are there economic pressures to keep going in those livelihoods or to not work and then to have those consequences? And of course, what we do with our livelihoods and our behavior choices every day will then affect where we live and how we use land. So this cycle is in the background and really is what drives some of the spillover events. Now, one of the interesting things to keep in mind is about 75% of the zoonosis or the diseases that have moved between animals and people have come from wildlife, not necessarily from livestock, as you might guess at first. So as we recognize the importance of wildlife as a reservoir for infectious diseases such as viruses, we realized we don't really know very much about what's there. And if we don't know what's there, we don't know what to look for in spillover. So the approaches that we used will work for livestock as well, and we have done that. But really this PREDICT project was focused on what's going on with wildlife and how might that spill over to livestock or people and contribute to outbreaks and pandemic potential. So over the 11 years that this PREDICT project was happening, we were working with teams across Africa, Southeast Asia, and then for the first 5 years in Latin America. And we were working with primarily primates, bats, and rodents. So you've heard me talk about bats and rodents already. They live very easily amongst our households, amongst our livelihoods and communities. Primates, because if you can make a monkey sick, you can probably make us sick too. Right? So they're not going to be as a hidden wildlife thing per se, unless you're out in the jungle or the forest, but they are important to understand what's going on with diseases in primates so that we can think about whether that's going to represent what might happen in our own human populations. And then if there were outbreaks reported concurrently, and we were invited from the government, then we would get involved in investigation and response for outbreaks from other species as well from time to time. So this One Health surveillance strategy was really thinking about what's going on with viruses in the wildlife first and foremost. You see that on the left. What might happen with transmission going from the wildlife to the livestock, from the wildlife to the people, and then potentially from the livestock to the people. So if we could understand what's going on and really be able to detect the viruses sooner in an outbreak, we might prevent a large part of the burden of disease. So we need that library of pre-existing viruses ideally, or we need to know how to find them quickly. We need to think about syndromic surveillance in people. So we were working with health clinics in these areas where we had high-risk interfaces to see what people were getting sick from. Were those viruses that we could also find in the local wildlife? And then what were some of the most important transmission potential interfaces? So it could be markets where you had multiple species in one place. MERS coronavirus was one that we were thinking about early on, where we had camels as a potential reservoir, and we would work with some of the livestock markets in East Africa and North Africa. In Southeast Asia, there might be places like the bat guano farms or wildlife markets where we would think about the potential for viruses to be evolving and to be changing in a way that might increase the risk for transmission to spillover for people or other animals. So when we were working with colleagues in the guano farms, for example, it may be that they are very committed to doing that work, but our job might be to just help them understand what's going on with disease risk, and then to think about what's the appropriate PPE or personal protective equipment that would make sense to help keep them safe in the midst of that, right? So it's not saying we can't do certain things, it's recognizing risk and using education to be able to think about choices, and then hopefully having an improved awareness to prevent disease spillover from animals to people, whether that's through PPE or changing livelihoods, right? There's a whole spectrum of different behavioral aspects we might think about. So really, this is how we went about our business. We started with models where we could increase the likelihood of looking for spillover events. Where have some of these diseases happened before? Where are the areas that you have high population density of people, high biodiversity of animals? Those are areas where you might see more spillover events based on what we had studied and modeled from the past outbreaks. So that would help guide out where we work, right? We were given certain countries and regions that were thought to be important, and we could then prioritize within those countries and regions, where did we want to be able to work with teams on the ground and be able to do surveillance to look for viruses in the wildlife and the spillover to people and animals. So that would take us into different types of field studies, and we would take samples from the animals, be able to take them to the local laboratories and use a consensus-based PCR, so a family level PCR that can identify known plus novel viruses that are related, and then be able to go from there to improve our models and shift a little bit what's happening. Now, of course, all along the way, this is part of just regular surveillance, but if there were outbreaks coming up, then we could then step up and be able to help understand what was going on with that particular outbreak event, if invited. And so that was an important contribution for the local ministries and country teams as we went along. Okay, so this was our approach to really thinking about how can we understand the viral families that we know have caused problems in the past, and within those viral families, identify the viruses that are already well known. If that's what's causing the problem or the sickness in people during syndromic surveillance, then we need to know that. If it's a related virus that we weren't aware of, but it's still in that viral family, that's also really important, because that may be one that's going to cause problems in the future. And so if we can know how to detect that quickly, then we may be in a better position to act early. And that's one of the benefits of this consensus PCR, a very simple approach to diagnostics that we could do in every country we worked in with the local teams, and have this similar approach to look in the same way across these 30 countries over the 10 years. Okay, So over that 11 years, 10 years plus a little extra that we had of this PREDICT project, one of the most important things, well, that was my bias, perhaps I was the lead for capacity team on strengthening, but one of the things I thought was really cool about this is that for every country we worked in, we had partners on the human and animal lab side who were ready to use the same consensus PCR approach and with sequencing to be able to understand the details of known and novel viruses. And so we were able to really develop the capacity to detect these known and novel viruses early on the front lines without having to like send things away all the time. And it was just much more self-sufficient. There was a lot of training that went on as on-the-job training. And that was really fun to be able to work with field teams on how do you capture bats? How do you work with rodents? You know, what's going on with non-invasive sampling techniques so you don't have to catch the monkey, but it can just chew on a swab and then you can test that swab. So there were some fun ideas that really came out as practical solutions. And then I think one of the long-lasting benefits of this particular project, the PREDICT program, was the capacity building for diagnostic platforms that are still up and running now. So during that 10 years or so, there were over 6,000 folks trained with that on-the-job training typically, over 60 labs that were partners. We were in about 30 countries during that 10 years. And the novel viruses are quite impressive. So we found a lot of viruses we knew about, but we also found a lot of viruses that we didn't. Now, just because you find a novel virus doesn't tell you that it's a bad actor or that it's a problem, but it does suggest that it's worth looking at if it's in the same viral family as ones that we have known caused a problem. So we were looking for viral families, including filoviruses, which would be Ebola type viruses. We discovered a new one, the Bomboli virus, is an Ebola virus that was discovered during the PREDICT project by colleagues here at UC Davis and then in Africa. The paramyxoviruses, coronaviruses, influenzas are other examples. Arenaviruses can be a problem. So these viral families as an approach for diagnostics was something that we found is giving us quite a bit to still work with, to understand then within those viruses, which ones may spill over. How do we evaluate risk based on viral characteristics as well as the epidemiology? And one of the really lovely things, which I know many of you are probably, well, part of the reason you do your jobs as well, is that we really love the people we work with. And so having colleagues around the world where you can write an email or pick up a phone or go to visit and sit together and work on some of these issues is really what kind of keeps us going every day, right? It's hard sometimes, not everything works sometimes, but having good colleagues where we can have rapid response, pushing and pulling of information. You know, this is one reason that working across the different sectors and disciplines has worked so well. If you find good partners, then you're much more likely to keep it going. And I think the PREDICT project and the One Health Workforce Next Generation project that's currently going on now is something that is trying to build this global network of practitioners. And I know that's what you guys are doing through the ICAP network as well. So I think that's really fantastic. So we're going to switch over into the One Health Workforce project. This is something that came on board as PREDICT was winding up. It was actually active during the PREDICT time, but it was called Respond at first for the first 5 years. Then it was called One Health Workforce. And then we took on a new global consortium as lead for One Health Workforce Next Generation. So that started almost 2 years ago. And we have these 2 regional networks. So let me tell you a little bit about how this One Health approach to really the global training grant idea works. So PREDICT was on the job surveillance and training. For One Health Workforce, we still can support on the job training, but really our main focus is the university networks, the faculty and the students in the university networks across Southeast Asia for Siahun and across Africa for Afrahun, or what was formerly called Oshea. So these 2 regional networks are really interesting because they use a hub and spokes approach to their model. So there'll be one administrative home or a secretariat administrative home in each of the 2 networks. For Siahun, that's in Thailand. For Afrahun, that's in Uganda. And then they will have the spokes of the wheel, which are all the different countries in the region that also can receive support and use a similar approach for training and for global health capacity building. So in the Southeast Asia region, there's 8 different countries. There's over 100 universities now. A lot of One Health student clubs. The students are fabulous, very creative. We'll talk a little more about that in a minute. And of course, COVID-19 response is something that has been a big part of what we do in this training grant over the past year or so, because the pandemic hit just after we launched. For AfriHoon, they're in 9 countries. So we just added Cote d'Ivoire as a recent addition to that portfolio, which is great. We're getting started there. So these 9 countries have had a nice broad reach from East to West Africa. They would love to expand further if that can be done in a practical way, and they're exploring how that might work for both of the regions. But these One Health University networks really do bring together a lot of different approaches to One Health, to training, and we've seen them broaden out to both work upstream in the pipeline with youth as well as downstream for on-the-job training or for continuing professional development, which I think will be more and more important in the future. So the goal of this USAID project is to empower these One Health University networks to sustainably develop and deliver these model programs for equipping professionals with the transdisciplinary skills, which is part of that One Health approach, to address complex global health issues. So I'm talking about zoonotic diseases because COVID-19 hit during this project, and that's an area where I've seen a lot of importance for antimicrobial resistance, for other viruses, for bacterial, foodborne, food safety issues. This One Health approach has been very useful, but certainly you could apply it to other ideas as well. And this project has really 4 components, 3 technical objectives and a cross-cutting theme. And so the workforce empowerment is the biggest piece, right? That's the external face. That's kind of the bread and butter of the main thing that happens is training in lots of different forms. So we have teams in all of the countries that are on the ground working on training, both face-to-face and virtually, and working on helping them to improve competencies, technical skills that are needed. Often the One Health competencies can fit into 3 different categories. One of them relates to health knowledge, another one relates to local and global processes, and the third really relates to professional characteristics. If you think about how any one of us were trained, perhaps we were trained with certain health knowledge as a physician or a nurse or a veterinarian, but if we can't put that knowledge into the local and global context, if we can't use the professional characteristics like collaboration and communication, leadership, then we won't be as successful. So these One Health competencies that have been developed and are being used for training in different ways are really important and I think are here to stay. What's a little bit unique about this particular project is that we have a charge to work on business operations with organizational sustainability, but also business operations in the form of knowledge management. And the ICAP teams are involved in all of these different objectives, but have really brought a lot of leadership in helping the regional networks to think about how do you work with knowledge management? How do you do alumni tracking? How do you come up with strategies to evaluate competency and assessments? So that's been a very important piece that's ongoing for this 5-year project. The organizational sustainability is helping these regional networks say, how do you develop the skills in the portfolio to receive funding from different sources and to manage that appropriately? And so there will be transition awards happening in about a year, which means the US government would be funding directly to the university networks in the region, at first in a small way and then in a larger way, to really help them develop the track record to show that you don't need a global consortium as the middle group necessarily. They can do it directly because they've been twinning and working so closely on those best practices. So that would be part of a kind of a special next step that will help to decolonize global health. It's an experiment to be able to say, look, can we really compete for different international funding sources in a way that is more sustainable for these regional networks across Africa and Southeast Asia? And I think that's really important. And then, of course, gender as a cross-cutting theme that we want to build into all of the different training activities and things we do to raise awareness and support gender integration is something that we've been working on. So in the first year of the project, which is where we have posted reports so far on the websites and such, if you'd like to read some of the different stories, The Student One Health clubs, the different country chapters have a lot of fascinating activities. I'll tell you a few of them in just a minute. But really over 20,000 individuals trained in the first year of that project. And that was a startup year, which means it was a shorter year than usual. And it was during the COVID-19 pandemic, which, as we all know, had a lot of challenges. So I'm very proud and happy that the teams were really as resilient and as committed as they were to get out there and be able to safely work with regard to training on different types of One Health approaches. So a few highlights just for the types of activities that were going on, because many of you may have been involved in these types of activities as well in your own way. So using the virtual platform to be able to build a One Health community of practice is something we started just as the COVID-19 pandemic was hitting. So we thought, gosh, this is something new. Not everyone knows what's happening. Let's try and get folks together online in a regular way. And so this series of webinars that were interactive would have speakers and presenters, but from the regions as well as from the global consortium. And over 50 countries were participating in this to share what's working and what's not for COVID-19 in that particular case. But now they've gone on to identify other topics. And so a One Health community of practice on antimicrobial resistance will be starting soon. Another one on e-learning is going to be up and running soon. So this idea of really connecting with all of you guys, like you're doing in grand rounds here, is something that's becoming more and more common, and I think will continue. Regional webinars led by experts coming from different disciplines was something that was happening in both regions and was pretty important because we need the leaders in those networks to be able to really understand what are the most important things to share or to overcome if there are barriers for knowledge and behavior change. The student clubs I mentioned at the university level were very creative. They came up with videos, they came up with risk messaging flyers about COVID-19 in this case. And so there are various contests that are happening or competitions that are happening through CIAHUN and AFRIHUN that provide opportunities to submit your ideas and to win a little something that will help to promote your professional development. So this was a really nice way to help empower and get creative during a challenging time. E-learning, of course, is something that became more popular, or we took it on more quickly than we might have otherwise because we couldn't get together face-to-face during the pandemic. So using online platforms for regular university teaching or for continuing professional development started happening in places where it wasn't very common before, looking for ways to improve internet access, helping people work from home, trying to really get out there and think about what makes sense. So you can do experiential learning, but still in a way that's safe for public health. And that had to be thought through in a new way as we had this going forward. The risk communication was a big part of the activities that were done in the first year because there were a lot of challenges that, is COVID real? What does that really mean for us? What should we really do? And so as we had the students at university saying, hey, we know what's going on, we want to go back and talk to people and really help to understand what they're thinking about and what makes sense. That was a really nice way to help to get the word out and to work on different ways to do community engagement. Internships and fellowships are something that goes beyond what we might learn in the classroom, and it helps with the experiential learning, thinking about what job you might want to be participating in after university. And so there are various fellowship and internship opportunities offered through all of the countries that we work in, as well as small grants programs from time to time. So different ways for people to say, hey, I want to do more. I want to get involved. I want to understand this One Health approach from a very practical standpoint. And so a lot of the international organizations, as well as the ministries and the local groups, will take fellows, and our project can provide support and oversight for some of that. And then the small grants program is something that will be coming up again soon. Different ways to help promote a One Health approach or pilot grants for the region. And that's been a way to unite faculty and students in new opportunities, and they have really appreciated that. So from this particular fellow, he was at ILRI And his comment was, this fellowship's really broadened his perspective to better mentor his students, thinking about how he can help them think outside the box, explore different opportunities, equip them with One Health competencies, and really apply One Health to improve the health of communities. So there's been a lot of good kind of follow-on and thinking through how do we apply a One Health approach, but in a tailored way that makes sense for an individual case or an individual community. And that's where some of the innovation and creativity come up with new apps or different ways to do surveillance with cell phones. It's very easy. And that way, even if you can't have experts everywhere, you can have eyes on the ground everywhere, and they can share unusual things, right? And that's how we've diagnosed outbreaks in the past. It's not that any one person knew, oh my gosh, there's an outbreak happening at first. They just thought, well, something's not quite normal. This is a little different than usual. And that's where really what got the attention to say, well, let's understand whether other people are seeing those things too, or whether other animals are experiencing those symptoms too. And that's how we've been able to act early and to be able to find responses a little bit more quickly. So I'm going to end here, and we can take a little bit of follow-on question and answer if people would like to. Please do think about visiting any of the websites or reaching out to us for more information about AfriHoon and SIAHoon opportunities, thinking about what's happening with the global consortium. Very happy to explore how we might work together in these different areas. But I think what we've seen is a global network is essential so that we can really share information quickly, so we can think about what's going on with potential spillover events and preventing the next pandemic, as well as responding to the current one. So let me go ahead and stop there and see if we have any question and answer or chat things that we should touch on.
Yes, definitely. Thank you, Woutrina. A wonderful presentation and really highlighting a perspective that we need to embrace more and more across various sectors. We have a very diverse audience. We have people from the US, Canada, South Africa, Tanzania, Lebanon, Peru, a number of universities in the United States, Cameroon, as you said, which is one of the new countries as part of the AfriHoon network. We also have the private sector. We have Chevron from Texas and others. So wonderful, diverse group of people. We do have one question, and I will ask one, and then I will put forward the second question that came in, and encourage others to put their questions either into the chat box or into the Q&A section, and we will put those forward to Woutrina. So my first question is, Woutrina, if we were to, as a global community, further embrace and fully embrace the One Health approach, how do you see, what would be the difference in the COVID-19 trajectory, the response to the pandemic, if people everywhere really utilized a One Health approach?
Yeah, thanks, Susan. And thanks, folks, for sharing your questions and ideas. The One Health approach would most obviously apply at the human-animal interface. If we think about the connections of where spillover happened for SARS-2 coronavirus, right? It was likely coming from a wildlife species, potentially a bat. We know that there are frequent interactions where people are exposed to wildlife excrement or through food sources, the different possibilities for transmission. So the One Health approach has a strong impact or an important part to play early on when spillover is happening, to think about how can we prevent that, how can we catch it early. So that's the detection of something's not quite normal, or what's going on here, that we need to think about the possible connections between people and animals and their shared environments. But as SARS-2 coronavirus evolved and changed how it could move between hosts, once it jumped into human-to-human transmission as its kind of primary way to cause damage, we still need the One Health approach. We need to work across sectors and disciplines to solve the problems, but in a slightly different way. We might not be thinking about disease transmission and how viruses jump from animals to people anymore. We might be thinking more about what's going on with human-to-human transmission and actually spill back, right? We saw that there can be transmission from people back to animals, and that also caused problems where you had culling of mink farms. You had concern about pet exposure and would that continue the cycle. So there were certainly still places we needed to think about how that health knowledge could be put into the important local or global context, and how the professional skills would be important to collaborate across sectors. So I think we do need that collaborative team-based approach no matter what. And I think that's really where we could do more to be able to work with health professionals and to try and prevent these things in the future, or to respond to them in ways that help to reach our different audiences, right? Because for me as a veterinarian, I might reach a different audience as a credible source, or see what's happening a little bit differently than you would as a nurse, or as a physician would with their practice every day, or an economist would if he's thinking about what's the impact of what's going on here. If we have a team-based approach, then we're more likely to come up with an integrated solution. And I think that's where we want to stay for the future, is integrated solutions that make sense.
I think that word integration is critical. Thank you. The next question is, what has been the uptake and involvement of governments in the in-country work of the USAID funded One Health Workforce Next Generation initiative? So the uptake and involvement of governments in this work.
Yeah, good question. I think uptake and involvement of governments and ministries has been happening more and more over time. So in the PREDICT 10 years that we started out in, we were always partnered and working very closely with ministries in all of the countries. But at first, some of them were, not quite sure what to expect, and are you going to really stick around and be able to make an impact that makes sense for them? Like, will it be useful? And as they saw this One Health approach in action that involves syndromic surveillance in clinics and the people, it involved understanding what's happening in the wildlife as reservoirs, or what's going into livestock illness in some cases. They could invite the teams to be involved in outbreak investigations and response. And that was really where they started to see the utility of recognizing that we need to build those sorts of responses and approaches into the national platforms. And so we actually saw One Health platforms coming up in some of the countries, even in the first 5 years of PREDICT, and that's continued more and more. Most of the countries have some intersectoral platform that brings a One Health approach at the national level. Not all of them, but a lot of them. And that's really increased awareness and collaboration across those sectors to try and institutionalize or sustainably operationalize the One Health approach beyond any one project, and really build it in as the framework. And that's transformational if that works, right? Because then you have connections, and it's not just the Ministry of Agriculture is very separate from the Ministry of the Environment or from Public Health. They're saying, hey, there are certain situations where we all need to really talk to each other very quickly and have an integrated approach and response. And so zoonotic diseases and spillover events like SARS-2 coronavirus are something that has strengthened the awareness. So they have increased buy-in and involvement over time. And that ranges anything from the platforms, as I'd mentioned, to hosting students and trainees in different jobs and doing outbreak response. So there's different ways that they've come to the table. But I do think that finding good partners and understanding how we can effectively work well with the ministries, as well as the missions from USAID and other funders, has been really important at the country level, separate from just the global kind of core vision that I think launched the whole thing.
We have two more questions that have come in. One is from a doctoral student in EPI with interest in One Health. Can you talk about specific One Health programs for postdoctoral students or for students currently pursuing their PhDs who have an interest in One Health?
Yeah, thanks for that, Thomas. So some institutions are offering specific degrees in One Health. You'll see that especially at the master's level, more and more institutions are offering master's degrees or curriculum that's focused on One Health in the name. Actually, for our institution and for some of the others that are very strong globally, we've chosen not to name the degree One Health because we still know that you need to be an expert in something to be on the team, right? So I mentor a lot of students who are doing PhD in epidemiology, They want a One Health approach as part of their PhD, but their discipline training might still be epidemiology. So don't be scared off by this idea that you have to have a degree that says One Health to really make it part of what you do. I would say that's definitely not the case. Do your PhD in epi, but look for ways to build in the One Health approach in the classes you take or the things that you do, so that you can really have this more collaborative, team-based integration in how you implement things. And I think that is just as strong, maybe more so, than really going after One Health in a way that you are a complete generalist, right? Because if there's a limited number of spots on a team that needs to be solving an important problem, you need to be an expert in something to have a special role in that team, as well as to be able to generally collaborate and communicate well amongst the group, if that makes sense. So there are more and more programs out there, but whether it's a cross-cutting opportunity or a specific degree program with the name One Health, both are great options for carrying on. And there are a lot of conferences, online trainings, different focused summer experiences, things that you can do. We have the RX One Health Field Institute that we offer every summer as an intensive, and we have graduate students as well as early career professionals coming together from all over the world, and they spend anywhere from 2 weeks to a month doing kind of a travel course that does One Health at the community level. We've been doing it in East Africa, we've done it in Sri Lanka, this year we're doing it in California. So there are different things that you can follow up on as you start to explore chances for global networking and for really practicing One Health ideas.
Great, thank you. We have, I think, time for one final question. This comes from Gurpreet and says, thank you very much for your presentation. Because of the challenge and early delays in identifying SARS-CoV-2, he says, what do you think we can do to improve our identification of viruses that cause possible pandemics? So either the speed with which we identify them, the being quicker in the response, more effective in the rapid response.
Yeah, good question. So rapid detection is really key, right? And that's why having teams on the front lines near the places where spillover might be happening, who can test samples from sick people or from sick animals early on, regularly, their kind of pipeline and their day-to-day job is really important. If you wait, or if you don't have that local capacity for detection, then the outbreak is spread much further before you ever know it's there, right? So a good example is in Thailand, where our PREDICT team was doing a really good job of just doing regular surveillance. What is it that's making people sick in the clinics through syndromic surveillance? What's going on the wildlife side with viruses we can find from some of those same locations? And they actually diagnosed the SARS-2 coronavirus before China did, 3 days before. So it was an example of just how having those techniques up and running, family level consensus PCR is not super fancy, but it was very practical. And then they could follow up with more advanced techniques with sequencing and developing the more focused, quick qPCR techniques. So early detection and just having practical ways to find the viruses soon was one of the keys to success. Because once you know it's there, then you know how to look for it more quickly in others, and then you can really implement the public health measures to prevent spread once you know what you're looking for. So that's one of the things that's going to continue to be important, I think. And we certainly can do it, but we have to choose to make that part of what the ministries and the different funders will support in an ongoing manner, because this will happen again, right? Spillover happens regularly, mini outbreaks happen regularly. So our job is then to figure out how do we be ready and get involved early so that we try and limit their spread. And that's going to be going on into the future to protect global health security.
Yeah, thank you. And I think COVID has really shown us we can do it. We have to be alert to the risk. Even though we knew the risks was there, we, as societies get into this lull or this false sense of security, and this last year has really heightened our awareness that we need to be at the ready. So in the interest of time, I'd like to hand back to Fatima to close out the session. And thank you again, Woutrina.
You're very welcome. Thanks for being here, everyone.
Great, thanks, Woutrina. And there are a few questions that did come into the chat and the Q&A if you want to just take some time to respond to them. But I just want to recognize our expert, Dr. Smith, for giving us a really wonderful summary of the intersection of human health and animal health in our shared environment. And I think, important to recognize as population grows, climate change forces people out of their habitats, and deforestation and the movement of people is leading to the spread of emerging diseases between animals and people. And I think we've learned from COVID that a multi-sectoral response is critical to mitigating and responding to a pandemic. And the One Health approach is critical to monitoring current and future public health threats. So thank you, Dr. Smith, for this wonderful presentation and collaboration on the One Health Workforce Next Generation Project. Just to note that our upcoming grand rounds will take place in June, and the topic will be on cancer prevention. So we hope that colleagues will join us for that session. Stay tuned to the webinar announcements on our website as well as our email communications. So thank you very much, everyone, for joining us from around the globe, and thank you, Dr. Smith.